Well, a warm welcome to this talk. It's Sunday, the 10th of November. Now, recently we made some videos from the Stone Conference, the memorial conference for Jackie Stone in Stormont in Belfast. And I want to play you another one of the recordings from that today with Dr. Clare Craig. Otherwise, these just tend to get a bit lost. And I think it's good that as many people see them as possible, because Dr. Craig always comes out with excellent points, as I think you'll agree if you give this video time, just to see if you want to watch. She talks about people dying or supposedly dying from COVID. She talks about the appalling prognostication that we had. These ideas from Neil Ferguson and Imperial College, I think it is in London, that were just on which lockdowns were based, which turned out to be less than accurate. Absolutely incredible. And then she talks about the deaths that were sometimes medically assisted, and other times through treatment that simply wasn't given. And she talks about the overdiagnosis of COVID with false positives, especially with people that had died. If you look at someone that's died and you swab them for any particular virus or bacteria, especially if they've taken some time to lead up to dying, if there's been a dying process, the odds are they're going to be colonised with all sorts of things, and that led to gross overdiagnosis. And she also talks about the vaccines not generating mucosal immunity, which has been brilliantly covered on this channel when we've had interviews with Professor Robert Clancy, who's educated us as to the vast importance of mucosal immunity and the fact that the vaccine gives systemic immunity, not mucosal immunity. Claire talks about what a vaccine non-effectiveness would look like, what vaccine effectiveness should have looked like, and she finishes off by talking about a mass disabling event where 2% of the working population in the UK is now off sick. Huge amount of disability. And of course she points out how this is the same in other countries which had common factors, all experience common factors, such as, you can fill in the blanks yourself. So let's watch Dr. Craig now, and then we'll be back.
We have just lived through a pandemic of fear. And when people are in fear, they look for a saviour. And that saviour was the saviour vaccine. But before we talk about the vaccine, we have to first of all ask the question of what it could have achieved. And we can only answer the question of what it could achieve by looking at COVID deaths. There are 4 types of COVID death, and we're going to go through each of them. The first were in people who were going to die imminently anyway. The second were medically assisted deaths, albeit without intent. The third were overdiagnosed COVID deaths, and the fourth were people who died because of a virus. So first of all, those who are going to die imminently, Neil Ferguson went from saying that 2/3 of over 80-year-olds would need intensive care if they had COVID, which put us into lockdown, to later that year saying 2/3 of the COVID deaths were in people who would have died that year anyway. So the second one was medically assisted deaths. There were do not resuscitate orders that were given out in a blanket way based on age or learning difficulties. And that happened at a time when hospitals were not admitting anybody that had a do not resuscitate order. So all those people were effectively denied medical care. Secondly, ITU care was rationed. And in spring 2020, 90% of the people who died of COVID had never had ITU care. Thirdly, people who had pneumonias were not being given antibiotics. And antibiotic prescriptions fell through the floor. Now, we know antibiotics save lives. So, of course, if you deny people antibiotics, they're going to die. And Pandemic Plan said we should have stockpiled them. Next, we had ventilators that were overused in order to protect medical staff. And later on, protocols had to be changed so that people weren't being killed with these ventilators. And then finally, we had end-of-life medications, midazolam and morphine, which were given in unprecedented quantities. And we know that these drugs reduce the respiratory drive. So giving them in people who needed that drive to stay alive would have caused extra deaths. So only when you've subtracted these deaths can you really see what the effect of COVID was. Then we had overdiagnosed COVID deaths. And about half, if you look at other data sources, about half of the deaths diagnosed as COVID, at least half, were overdiagnosed. And that happens partly because testing was far too sensitive. So a single aerosol, 5/1000ths of a millimetre in size, containing 3 or 4 viral particles, was enough to say somebody tested positive, and then enough to say their death was from COVID. And we know that people who die of any cause, if you swab them after death, half of them have a respiratory virus on board because their immune system was failing at the end of their life. So these were not real COVID deaths. So now, having subtracted all of those deaths, we're left with the people who died from a virus. Now, even for them, this vaccine couldn't prevent their death, because they certainly couldn't have prevented an infection, because you need to have an immune system that's stopping the virus entering the cells in the respiratory system. And these vaccines produced antibodies in the bloodstream, which might work for something like measles, which replicates in the lymph node, but isn't going to work for a virus that replicates in the airway. Now, what all that means is that the trials didn't work. And if you look at a different measure, the antibody positivity in the people who were in the trial, what you see is that the efficacy only looked at around about 50%. And what we now know is that people who are vaccinated only develop these post-infectious antibodies at about half of the infections. So if you take that into account, you can see that the trials never really did reduce infection. Now, what we also know is that the first period after injection, for 2 weeks at least, the risk of COVID is about 40% higher. So the immune system is preoccupied with trying to get rid of the foreign protein that the vaccine is making, and then isn't able to stop you being infected with the virus. So all that really happened in the trial is that the people who are susceptible had their infections earlier, that period was ignored, and they created this illusion of success. Everybody now admits that these vaccines cannot prevent infection. Now, what about serious illness? Well, even in the trial, there were thousands of people had to be injected to prevent a single serious infection. And government data has since shown similar numbers, with hundreds if you're over 70-year-olds, thousands in slightly younger groups. And once you get into the very young, you're talking about hundreds of thousands of people needing to be injected in order to prevent one single serious case of COVID. In the meantime, the trials also showed 1 in 800 developed a serious side effect. So the chances of harm were higher than the chance of benefit. And that is even in a situation where we know harm in the trial had been hidden in the data that was sent to the regulators. So let's just quickly look at what success should have looked like. A successful vaccine should have reduced the levels of virus being produced on a population scale as measured by virus in the wastewater, in the sewage. But we've seen the same waves that are continuing to this day, peaking at predictable times of year, and are of the same magnitude as they ever were. A successful vaccine should have reduced the percentage of household contacts who ended up with an infection, but this stayed the same before and after vaccination. It should have reduced the intensive care and death numbers. Now, we did have a reduction from 2022, but that was due to the Omicron variant and nothing to do with the vaccine. But in the 2021, after the vaccine, in Europe and the USA, the magnitude of the intensive care and death waves was exactly the same. It should have reduced the mortality rate in countries that were vaccinated before they had their first COVID waves, but they still ended up with 400 deaths per million in those waves, which is comparable to what we saw in Europe and is half what we saw in the UK. But Omicron's half as deadly, so where's the vaccine benefit? And it should have reduced the percentage of people hospitalised with COVID who died, but that stayed the same. Now, what does failure look like? Well, what we saw was in spring 2021, there was a jump in life-threatening ambulance calls that has not come back to normal since. That jump happened just during the vaccine rollout, nothing before and nothing since. And there was only 15% of people who had had COVID at that point. And since then, almost everybody's had it with no further rise. There was a massive rise in pressure in hospitals, which was not seen with COVID and has continued ever since the vaccines. Coupled with that were excess mortality, which is mainly cardiac and has been seen in more heavily vaccinated areas. And critically, these extra pressures on hospitals and deaths of cardiac problems have been seen in Australia and Singapore. And they had COVID at a completely different time frame to the vaccines, but they had these problems at the same time as everyone else. And we've seen record levels of adverse events in the reporting systems of conditions that are being backed up by surveys of the vaccinated. Overall, there's been a mass disabling event. And to add insult to injury, we've now got a situation where immune systems have been harmed by people who've had multiple doses of the mRNA, and their immune systems have switched to ignore the virus as if it's just food or pollen. So just to finish up, I think it's important to emphasise that not everybody has been harmed. Drugs that are dangerous don't harm everybody who takes them. That's never the case. But a significant number of people have been harmed. So what we know is that 2% of people who took a first dose didn't come back for their second. Why wouldn't you complete the course? 2% of people who were injected and carefully followed up showed evidence of heart damage afterwards, even when they had no symptoms. And 2% of our working age population are now unable to work because of long-term sickness.
Well, thank you for that, Claire. Concise and full of information as always. And of course, you probably know that Dr. Craig is an NHS trained consultant pathologist and author of this rather excellent book, Expired. I will put the link in the description, that we've gone through in detail on some videos with her. In fact, several videos in great detail. In my view, this is the most concise explanation, really, analysis of what went on during the pandemic period and lessons to learn for the future. So that's what I wanted to say today. Basically, this video is finished now, but the idea of lessons to learn for the future is one that's in my head at the moment. And the video is finished now, so this is just my personal reflections. You can log off now if you want to. But I was at church this morning, and it's the Sunday, the 10th of November, the closest Sunday to the 11th of November, when the guns fell silent on the Western Front, of course, of the 11th day of the 11th hour of the 11th month, which is tomorrow, and the closest Sunday was today. And every year we read out the list of the names of the men from the parish that died in both World Wars. And what struck me this morning was just how long it took. It's a relatively small parish in Carlisle, in the north of England. And it took about 2 minutes, must have been about 25, 30 names being read out, sometimes the same surname repeated. Just imagine the mother there when first one brother was killed and then the other brother was killed. So I think I want to reflect on that a little bit, because there's so much we can learn. But when I talk about these things, there's two main emotions come to mind for me. The first is tragedy. That the events that have taken place in the wars and on ongoing events are just utterly tragic. We've been failed by people that are supposed to be in charge repeatedly over the generations, and it's the ordinary people that suffer from that. So the complete tragedy of what's happened. And that gets you a bit despondent. But then the other sentiment that comes to my mind is nobility, the sheer nobility of what a lot of these young men and women did. And I just want to show you a few of my pictures. I haven't been to France for about 10 years now, but these are some pictures. This is the Thiepval Memorial to the British dead of the Somme. So many men that died on the Somme, of course, they had no known grave. But still no known grave. So this is the Lutyens Memorial at Thiepval, put up to commemorate those with no known graves. You can't see it, there's not enough resolution here, but there's about 60,000 names engraved onto these walls in the memorial. And I go every time to the war graves. These are actually French graves. This is at Verdun, the big French cemetery at Verdun. This is one of the American memorials, beautifully done. And you can just imagine when, over time in the 1920s and 1930s, parents of the deceased will go there and think, yeah, you know, this is appropriate. This monument is a befitting memorial to my loss. Really quite moving still to visit. Been erected by the United States of America to commemorate the service of her troops and those of France who fought during this region. And that's the other thing this brings to mind, the common history that we have in the United Kingdom, the United States, Canada. Whenever I go somewhere, I always go to the war graves, and there's Kiwis, there's Aussies, there's Brits, Scotch, Irish, Welsh, English. There's Americans, North and South, East and West. There's Canadians, people from all over who have this common history. And hopefully we'll learn from it, because we're making some pretty serious mistakes at the moment, I would have thought. Anyway, back to this is another one of the American sites. Again, beautifully done. The American war cemeteries. These are the American crosses. They speak for themselves, of course. Beautiful marble crosses, each one to an individual. Thomas McHugh died on the 18th of July 1918, when I guess he should have been in a farm or in a shop in Wisconsin. These are the American graves. These are actually German graves, more densely buried than the Americans and the Brits. This shrubbery contains 3,000. It's a mass grave of 3,000 young Germans. So when I was of young military age, early 20s say, I had quite a few German mates, and the idea that we could have hurt each other was an anathema. I would have rather jumped off a cliff than hurt one of my German mates. And yet, previous generations, it just shows it's not to do with the individuals. This is about failure of government and organisation. Failure to heed warning signs as we went along, perhaps. Still walk through some of the trenches. Ziggy-zaggy trenches to stop the explosions going along the trench line. British memorials, all beautifully maintained by the Commonwealth war graves, each individualised in Portland stone. And whenever we go, I always have to go off on my own, walk down through the rows. Don't retain composure, of course. Have to wander off on my own down the rows. You go to northern France, Flanders, Picardy, the Somme area. These graveyards are just everywhere. The poppies still blow, of course, next to the farmers' fields. So many. That's a Tyncott Cemetery. And that's some barbed wire from Omaha Beach. It's about 12 years ago I took that picture, but I guess there's still some there. There's an awful lot there at the time. So we've seen tragedy to warn us, and we've seen nobility to inspire us. And it really concerns me now, because we stand on the shoulders of giants intellectually, but we stand on the shoulders of giants morally and culturally as well. We stand on the shoulders of these giants that have gone before us in previous generations. And yet, so many of the freedoms that they fought and died for are now under serious threat once again. Let's hope this time we recognise the danger soon enough. But the way things are going, I'm not convinced that we are. So they shall not grow old as we that are left grow old. Age shall not weary them, or the years condemn. At the going down of the sun and in the morning, we will remember them. Thank you for watching.